Senator Murkowski? Yeah, Senator Murkowski, 5 minutes.
Senator from Alaska.
Thank you, Mr. President, and thank you to my colleague from Iowa. Mr. President, in this morning's Wall Street Journal, there's an article, actually an editorial, and it starts out, "Another day, another study confirming that Obamacare will increase the price of health insurance." And it goes on to talk about a Blue Cross study. It talks about CBO numbers, but the reality that you've got numbers all over. I think we all recall the quote from Mark Twain, "You've got liars, damn liars, and statisticians." Well, I think we are caught up in that world now of dueling numbers. Our numbers say that this is going to increase your premiums. The other side's numbers say it's going to decrease your premiums. So the real question is who's right and whose numbers do you look to? Well, I think it's important, as so many of my colleagues have mentioned this morning, and when we're talking about whether it's the home health care statistics in a state, the impact, look to those states and what they're saying the impact will be. So I have gone to our state's think tank, if you will, the Institute for Social and Economic Research at the University of Alaska is the entity that does a lot of analysis, not only on healthcare policy and issues, but other economic issues. And I've asked them, let's sort through some of these numbers. Let's sort through some of the statements that have been made out there. And I think it's important to share this morning some of the statements coming out of ISER. When we talk about the premiums that Alaskans are going to face, instead of a statement, a very simple statement that, well, your premiums are going to go down, what ISER is saying is that when we look to the CBO estimate of the increase in the average premium for the non-group market, what we expect to see is about a 12% increase by 2016. For a single coverage, this is about $1,160 a year. For a family coverage, it's about $2,900 in 2016. Now, what ISER is doing is they are still conducting the analysis to determine the extent of the subsidies that may be available for Alaskans that could in fact reduce those premiums. But I think it is important to just make clear that we're understanding what we're talking about when we make statements about, well, this is going to increase or this is going to decrease. We need to make sure that we are looking at all of the numbers. CBO has very, very clearly stated that the average premium per person for new non-group policies is going to be between 10 and 13% higher in 2016 than the average premium. So you've got to say, well, what's the difference between that statement and the statement that the Democrats have made, saying that the premiums are going to decrease by 14 to 20%? Well, you've got to look behind the screen here, behind the curtain. Two of the factors, administrative efficiencies and new enrollment, will make premiums go down, but these reductions are then overwhelmed by a 27 to 30% increase in premiums because of the coverage requirements that are mandated within the bill. And the Democratic analysis that is out there omits this 27 to 30% increase, fundamentally flawing the analysis. What are some of the other things that ISER has taken a look at as it relates to this bill that is before the Senate right now? They've stated that because Alaska is a high-cost state, it's highly likely that health insurance plans in Alaska will become subject to the excise tax on health insurance sooner than the U.S. average. The preliminary estimate is that roughly 50% of health plans in Alaska will be subject to the tax by the year 2016, compared to only 19% average in the rest of the lower 48. They've also indicated that while the uninsured population will be reduced in Alaska, adding approximately 65,000 new enrollees to the market, their concern, and this is a statement that I think is very important, we continue to be concerned that the newly enrolled Medicaid expansion and through the new exchange will create a big surge in demand that could easily create what they call a traffic jam in the healthcare system, send the Medicare beneficiaries to the back of the line in Alaska due to Medicare's low reimbursement rate. This is exceptionally important for us to understand. On today's front page of the Washington Post, there's an article about
Senator's time has expired.
in Texas. And the only statement that you need to remember from this article is that even with insurance, you need somewhere
Senator's
to
time
go.
has expired.
Thank you, Mr. President. I yield the floor.
Mr. President, I yield myself